Welcome students. This is the fourth lecture of unit number 2 of Biopharmaceutics and Pharmacokinetics, and the topic for today's lecture is known renal routes of drug excretion. Okay. In the last lecture I have told you about the renal excretion of drug and the different factors affecting the renal excretion of drug. So, in this lecture I will discuss about the known renal excretion or known renal routes of excretion. Okay. So, the drug or their metabolites they can get excreted out by other routes other than the renal route also, okay. And these other routes are called as the extrarenal or non renal routes of drug excretion. So, there are different processes that are involved in the non renal excretion. These are, first one is the biliary excretion, second is the pulmonary excretion, third one is the salivary excretion, fourth one is the mammary excretion, fifth one is the skin or dermal excretion, sixth is gastrointestinal, and seventh one is the genital excretion. Okay. So, there are these 7 types of excretion, or we can say these 7 types of non renal excretion. Okay. The first type of excretion is the biliary excretion, and we can also say it is as enterohepatic cycling. Okay. So, the phenomena of drug cycling between the intestine and the liver is called as the enterohepatic cycling, and the compounds that are excreted in the bile we can classify them into these 3 categories. Okay. First of all, let's understand the concept of enterohepatic cycling. Okay. See, this is the diagram that is showing the enterohepatic cycling. When from the systemic in the liver, there is the secretion of bile from the bile is getting excreted from the liver into the gallbladder. Here it is getting the stored. Here it is getting stored, but from this gallbladder it can excrete out into the intestine, and from this intestine it can reabsorbed via the hepatic portal system into the liver again. So, this cycling of bile from the liver into the liver, from the intestine and into the liver is called as the enterohepatic cycling. Okay. The bile is excreted from the liver and then it can store into the gallbladder. From here it can also excrete out into the intestine. From intestine it can reabsorb into the liver, and this reabsorption of bile from the intestine to the liver is called as the enterohepatic cycling. Okay. So, the drug can also get excrete out with the help of bile, and that process is known as the biliary excretion. Okay. So, the compounds that are excreted in the bile we can categorize into 3 different categories: group A, group B and group C. Now, what is the criteria on which these are categorized? The criteria is the ratio of bile to plasma concentration. Depending upon the ratio of bile to plasma drug concentration, we can classify these drug into 3 categories, that is group A, group B and group C. In the group A, ratio is approximately 1. Which ratio? The ratio of bile to the plasma drug concentration. Okay, that ratio is approximately 1. For example, in case of sodium, potassium and chloride ions and glucose. Now, next category is the group B category. In the group B, the ratio of bile to plasma concentration is more than 1, and this ratio can vary from 10 to 1000. This can be from 10 to 1000. Okay. For example, bile salts, okay, or creatinine we can say, or bilirubin, glucuronide or creatinine and conjugates, etc. Third category is the group C, that is having the, in this bile to plasma drug concentration ratio is less than 1. Okay. For example, sucrose, inulin, phosphatase, phospholipids and certain mucoproteins. Okay. So, these are the 3 different categories in which we are categorizing the drugs on the basis of their bile to plasma drug concentration ratios. Okay. Now, there are several factors that can influence the secretion of drug in the bile. Okay. As I have explained you in the next lecture about the factors affecting renal excretion of drug or the factors affecting the secretion of drug through the kidney. Now, there are also certain factors that are involved in the excretion of drug in the bile. So, the factor can also influence the biliary excretion. So, these factors are, first is the physicochemical properties of the drug. Okay. First property is the physicochemical properties of the drug, and in the physicochemical properties, the properties are polarity, greater lipid solubility. Greater is the polarity or lipid solubility, greater will be the biliary excretion. Okay. So, if the polarity is the physicochemical property of the drug that can affect the biliary excretion. If there is greater polarity, there will be greater biliary excretion. Also, the biliary excretion also depends on the molecular weight also. Okay. A threshold of 300 Dalton or greater than 300 Dalton is necessary for the organic cations and organic anion respectively. Okay. We can say there is some influence of molecular weight on the biliary excretion. Okay. So, we can say that if a drug compound is below 300 Dalton, we have three different categories. In the first category, the drug compounds are having molecular weight less than 300 Dalton. In the second category, it is above 300 Dalton, and in the third category, it is between 300 to 500 Dalton. Okay, we are having three different categories depending upon the molecular weight. In the first category, the molecular weight is below 300 Dalton. So, these type of drug excreted mainly in the urine, less than 5% drugs are excreted into the bile. In the very first category, these are excreted mainly in the urine, excreted mainly in urine. Only 5% of the drug are excreted into the bile or can undergo the biliary excretion process. Okay. In the second category, that is if the molecular weight of drug is above 300 Dalton, then it will be excreted mainly into the bile. Only or less than 5% will be excreted into the urine. Third category is the 300 to 500 Dalton. In this category, the drug will be excreted both in the urine as well as into the bile. Okay. So, this is the factor of, this is the influence of the molecular weight on the biliary excretion. Okay. Next factor is the nature of biotransformation process. Okay. A metabolic reaction or metabolic reaction can greatly influence the polarity as well as the molecular weight of the drug. Okay. If the compound or drug component is having higher polarity, then it will favor the biliary excretion. Okay. So, phase 2 reaction, for example, the glucuronide reaction, sulfate conjugation, they will favor the biliary excretion process. Okay. So, there are certain other factors or miscellaneous factors also that can affect the biliary excretion. For example, the gender, for example, age, the species difference, protein drug binding, disease state or drug interactions. So, these parameters can also affect the biliary excretion of the drug, or we can say known the other excretion of the drug, other routes of excretion of the drug. Okay. So, as I have told you about the renal clearance, what was the renal clearance? It was the ability of the drug to get completely excreted out with the help of kidney. Similarly, there is the biliary clearance, and this biliary clearance we can obtain by the formula, that is the biliary clearance rate divided by the plasma drug concentration. Okay. How we will get the biliary clearance? The formula for calculation of biliary clearance is it is equal to the biliary clearance rate biliary clearance rate upon plasma drug concentration. Okay. In the renal clearance, here was the urinary excretion rate in spite of biliary clearance rate. Okay. In the renal clearance, the formula is urinary excretion rate upon plasma drug concentration, and in biliary clearance it is biliary clearance rate upon plasma drug concentration. Okay. So, next type of excretion or next type of non-renal route of excretion is the pulmonary excretion, and as the name indicates, pulmonary excretion means the drug is getting excreted out with the help of lungs. Okay. So, the gaseous substances, volatile substances, for example, the general anesthetics, that is halothane, they can absorb through the lungs by simple diffusion process. Okay. So, the pulmonary blood flow, the rate of respiration and the solubility of the substances, these are some factors that can affect the pulmonary excretion. Okay. In the pulmonary excretion, the intact gaseous drugs can get excreted, but their metabolites cannot get excreted out. Okay. The alcoholic drugs or alcohol compound which is having the high solubility in the blood and tissues, they can excreted slowly by the lungs. Okay. So, this was about the pulmonary excretion. Next excretion is salivary excretion. As the name indicates, in the salivary excretion there is involvement of saliva. Okay. So, excretion of drug in the saliva is a passive diffusion process, and therefore, it is predictable on the basis of pH partition hypothesis. The pH partition hypothesis, this we have already discussed in the first chapter, that is the drug absorption. Okay. So, pH partition hypothesis is affecting the drug absorption process. Similarly, it is affecting the drug excretion through the saliva. Okay. So, the unionized lipid soluble drugs are excreted passively in the form of saliva. Okay. If we found bitter taste in the mouth, that reason behind that bitter taste is in the patient is indication of drug excreted, means the drug is getting excreted through the saliva, because of that the taste is bitter. Okay. There are some basic drugs also that can inhibit the salivary secretion, and they are responsible for the dryness in the mouth. Okay. So, this is about the salivary secretion, in which the drug is getting secreted or excreted out in the form of saliva. Okay. Next type of non-renal route of excretion is the mammary excretion. Okay. So, excretion of drug in the milk is very important, because it can gain entry into the breastfeeding infants. Okay. So, the milk consists of lactic secretions which is rich in fats and proteins. Here, in case of mammary excretion, the free, unionized and lipid soluble drug can diffuse passively. The pH of the milk varies from 6.4 to 7.6. There are certain potent drugs like barbiturates and morphine that can induce the toxicity. Okay. So, if there is high plasma bound drug like diazepam, that will be less secreted in the milk, means if the drug is getting bound to the plasma protein, due to this their molecular size is increased, and due to this higher molecular size their secretion is less in the milk. Okay. Next type of secretion is the skin excretion. Okay. Skin excretion, as the name indicate, in this the drug is excreted out in the skin. So, when the drug is excreted through the skin or via sweat, it will also follow the pH partition hypothesis. Okay. And sometimes drug that is excreted from the skin, it can lead to urticaria and some other disorder like the dermatitis. Okay. For example, the compounds like benzoic acid, salicylic acid, alcohol and heavy metals like lead, mercury, arsenic, these are excreted out in the form of sweat. Okay. So, there is the passive excretion of metabolites that is responsible for hypersensitivity reaction or urticaria or dermatitis. Okay. Next type of excretion is the gastrointestinal excretion. Okay. The excretion of drug into the GIT, that is the gastrointestinal tract. Okay. So, the excretion of drug into the GIT will occur after the parenteral administration when the concentration gradient for the passive diffusion is favorable. Okay. So, this process is reverse of the GI absorption of the drug. Okay. In this, the water soluble and ionized form of weakly acidic as well as basic drugs are excreted out in the GIT. For example, nicotine and quinines, these are excreted in the stomach, or some oral administered drug can also be absorbed and excreted out in the GIT. The next type of excretion or last type of excretion is the genital excretion. Now, in the genital excretion, some reproductive tract and genital secretions may also contain the excreted drug. For example, some drugs have been detected in the semen. So, the drugs can also be excreted via the lacrimal fluids also. Okay. So, we are having the different excretion pathways and different transport mechanism and some drugs that are excreted through the different known renal routes. Okay. For example, we are having the different route. For example, first route is the urine, in which the drug is getting excreted into the urine, and when drug is getting excreted into the urine, we are having three different mechanisms, that is the glomerular filtration, active secretion and tubular reabsorption. Three different mechanisms are involved when drug is getting excreted into the urine. And which type of drug molecule can excreted into the urine? The drug molecule that are hydrophilic in nature, that are unbound, the drug component which molecular weight or molecular size is less than 500 Dalton. That type of molecule can get easily excreted out into the urine. The another route is the bile. So, in case of bile, the active secretion mechanism is involved. The mechanism is active secretion. Okay. So, in active secretion, some hydrophilic compounds or the unchanged drug or their metabolites that are having the molecular weight more than 500 Dalton, that can be excreted out. Next type of route is lungs. In the lungs, there is the involvement of the passive diffusion. The mechanism involved is passive diffusion. Okay. So, gaseous substances that are volatile in nature or general anesthetics can get excreted out with the help of pulmonary excretion. Next route is the saliva. In the salivary excretion, the mechanism involved is passive diffusion as well as the active transport. Passive diffusion and active transport. Okay. So, the free unionized drug and lipophilic drug can get excreted out in the form of saliva. Next route is the milk, and last one is the sweat glands. Okay. In the milk, in the sweat gland and as well as in the intestine, the passive diffusion is involved. In both the process. Okay. In the milk as well as in the sweat glands, the free drug or unionized drug and the lipophilic drug can get excrete out into the milk as well as in the sweat glands. Okay. So, these are the different types of excretion route and their transport mechanisms that are involved in the non-renal route of excretion. Okay. So, before ending this lecture, let us have a recap. So, I have told you about the different non-renal route of drug excretion. We are having this 7 types of excretion. First one is the biliary excretion. When the drug excretion takes place through bile, then it is called as the biliary excretion. When drug excretion takes place with the help of lungs, then it is called as the pulmonary excretion. Okay. Next is the salivary excretion. When the drug excretion takes place with the help of saliva, or the involvement of salivary gland is here, then it is called as the salivary excretion. Next is the mammary excretion. When there is involvement of the milk glands, then there it is called as the mammary excretion. Okay. When the drug excretion takes place through the skin or through the sweat, then it is called as the dermal excretion. When the drug excretion takes place through the GIT, then it is called as the gastrointestinal excretion, and when genital organs are involved or reproductive tract is involved, then it is called as the genital excretion. Okay. In the biliary excretion, there is a drug cycling between the intestine and the liver, that is called as the enterohepatic cycling. Okay. So, the compounds that are excreted in the bile, they are categorized into 3 different categories on the basis of their ratio of bile to plasma drug concentration. Okay. So, on the basis of that ratio, these are categorized in group A, group B and group C categories. Okay. So, what is group A categories? In the group A, the drug are placed which are having the bile to plasma drug concentration ratio approximately 1. For example, sodium, potassium and chloride ion and glucose. In the B category, the ratio of bile to plasma drug concentration is between 10 to 1000. Okay. The example is bile salt, bilirubin, phospholipids, etc. In the group C, the ratio of bile to plasma drug concentration is less than 1, for example, sucrose and inulin. Okay. There are and as likewise in the renal excretion of drug, as there were certain factors that were affecting the secretion of drug into the through the kidney. Similarly, there are also involvement of certain factors that can affect the secretion of drug into the bile. Okay. These factors are physicochemical properties of the drug, nature of biotransformation process, or some other factors are also there. Okay. In case of physicochemical properties of the drug, it is molecular weight that can affect the secretion of drug into the bile. Okay. So, on the basis of molecular weight, we can have 3 different categories. First category is the drug compound having the molecular weight below 300 Dalton. Second is the drug compound that are having the molecular weight above 300 Dalton, and third category is the drug compound that are having the molecular weight above between 300 to 500 Daltons. Okay. So, the categories in which there is below 300 Dalton molecular weight, in that the drug is mainly excreted into the urine, and less than 5% of the drug excretion takes place through bile. In the second category, when the molecular weight is above 300 Dalton, in this case the maximum or mainly the drug excretion will takes place into the bile, less than 5% will takes place into the urine. In the third category, here the involvement of bile as well as urine is there. The drug excretion can be in the urine as well as into the bile. Okay. Next is the nature of biotransformation process. Okay. Nature of biotransformation process can also affect the biliary excretion. Okay. If a drug is highly lipophilic, then it can undergo the biliary excretion process. Okay. Some other factors can also be there, for example, the gender, species, strain difference, these can also affect the biliary excretion. Another type of excretion is the pulmonary excretion that can takes place with the help of lungs, and gaseous substances or volatile in nature substances or alcoholic substances can get easily excreted out with the help of lungs. Next is the salivary excretion, where the involvement of saliva is there. Mammary excretion, in this there is involvement of the milk or mammary glands in and the free unionized and the lipid soluble drug can be excreted with the help of passive diffusion process. In the skin excretion, there is the involvement of skin, or the drug can be excreted out via sweat glands. In the gastrointestinal secretion, there can excretion with the help of GIT tract. And last one is the genital excretion, in which the reproductive tract or genital secretion can the drug can be excreted into with the help of genital tract genital organs. Okay. So, in this the excretion can takes place with the help of lacrimal fluids also. Okay. So, some drugs have been detected in the semen. This was all about the known renal routes of drug excretion. Thank you.